Well, folks, welcome back, and thanks for staying tuned to Leading Businesses, Leading Communities. Our health and wellness segment is sponsored by Humana, and it offers a wide range of insurance products and health and wellness solutions for employers and individuals. Humana has learned that people are in better health when they're active and engaged in their social lives, their communities, and their families. Humana helps people achieve lifelong well-being by offering products and programs that meet an individual's physical, social, and emotional needs. Northern Kentucky Chamber members receive preferred pricing on Humana's medical, dental, vision, and life products. Contact your health benefits broker for more information, or you can visit humana.com. With me today is Dr. Ned Melman. He's a cardiologist and director of the Women's Cardiac Division at St. Elizabeth Healthcare. Dr. Melman, welcome.
Thank you very much.
Glad to have you.
Pleasure to be here.
So we're going to focus on women's heart health today, and we heard some statistics at the beginning of the show that are kind of scary, that heart disease and heart illness, really are bigger than breast cancer, and a lot of folks will be surprised about that. But why the focus on women rather than just heart in general?
Well, first of all, it was discovered, as various studies which were done within the last 10 or 15 years, that there's been a lot of progress made in terms of treating heart disease. But as it turned out, as I started to break down the data, the progress in women lagged behind. And there were various reasons for that. It was appreciated that women often present differently with heart disease. And despite the fact that they perhaps anatomically have what appears to be less severe heart disease, turn out it's not less severe because they end up doing much more poorly over the long run. And as a result of that, there's been a tremendous focus in terms of education from the standpoint of educating doctors, physicians, cardiologists, and primary care physicians in terms of that more focus should be done in terms of diagnosing and treating women's issues, but also on women themselves.
And the candidates for your program in particular would be whom, and the types of services that they would be coming to see?
Okay, so we're not interested. We certainly, if we happen to pick up a patient and comes in, we diagnose heart disease, we certainly would pass that along to the appropriate, we make the appropriate referral to treat that. That's not what we're interested in. We want to pick up the people before they actually have clinical disease. So we're interested in people who are running busy lifestyles. Perhaps their lifestyles are not ideally what they should be. Perhaps someone is overweight, someone who has a positive family history, someone who is perhaps wasn't aware that of all the symptoms of heart disease, and suddenly finds out that several aunts or uncles have just been have recently passed away, or they've had premature issues with heart attacks or strokes, and all of a sudden they become very frightened. They want to know, well, what's my risk?
We have about a minute left. Talk a little bit about the services and the collaboration between some of the folks that are involved in your program, and where are you and how do they access you?
We're located, we can either be accessed through the website at St. Elizabeth Hospital. If you go to services and under women's wellness, and then there's a separate segment there that says the women's heart health. You just access that way, or there's a phone number, and we are actually located at Fort Thomas Hospital in the Women's Wellness Center. And what we're providing in a boutique-like atmosphere is we want, in an affordable way, to basically give a woman an accurate assessment of where they're holding in terms of their potential risk of heart attacks and heart vascular disease down the line. And we'd like to tailor-make a program for them vis-a-vis exercise, diet, other modifications that would potentially lower her risk of heart disease down the line. The other issue that's important is we want women because, number one, they're the main issue that we're trying to deal with, but also they run their families. If you get a woman on board, then you have her family, you have her husband also.
Yeah, well, certainly a critical issue that folks really need to pay attention to. Dr. Melman, thanks. That's all the time we have. Thanks for being on our show, sharing this very important information. Folks, we're going to take a short break, and when we come back, we'll wrap up this edition of Leading Businesses, Leading Communities, so don't go away.